We chose BRIGHTCELL Laboratory as the name of our laboratory because it reflects clarity, precision, and scientific excellence in the field of medical technology. Bright represents advanced diagnostic technology, accuracy, and innovation, while Cell highlights our focus on essential biological and clinical analysis. BRIGHTCELL Laboratory is a laboratory that provides comprehensive diagnostic services across major sections such as clinical chemistry, hematology, clinical microscopy, microbiology, immunology and serology, blood banking, and histopathology. Our group facility includes complete testing areas and essential support rooms to ensure smooth workflow and patient flow.
The laboratory upholds strict safety practices through proper PPE use, biosafety procedures, and regulated waste disposal, while maintaining high-quality standards through accurate specimen handling, reliable analytical processes, and compliance with DOH regulations. Overall, BRIGHTCELL Laboratory aims to deliver precise, efficient, and dependable diagnostic testing in support of patient care.
This organizational chart shows how a tertiary clinical laboratory is organized and how the different parts of it work together. At the top are the main groups like quality and safety, laboratory management, and clinical laboratory services. Each group is handled by important staff members such as the quality assurance officer, laboratory manager, and chief medical technologist, who make sure everything runs smoothly.
So, the chart also outlines the specialized laboratory sections such as hematology, clinical chemistry, serology, immunology, and microscopy. Each section is supervised by a section head to ensure that all testing procedures are performed accurately and efficiently and in compliance with the laboratory standards. These sections heads manage the workflow within their areas and ensure that proper techniques and protocols are followed.
So, in addition, the chart includes key support units such as the phlebotomy, patient services, and information system and equipment support. These departments handle the sample collection, patient registration, result release, system maintenance, and equipment checks. Overall, the chart clearly shows how each team works together to keep the laboratory organized, efficient, and reliable.
The 2D floor plan presents a well-organized tertiary clinical laboratory designed to support efficient workflow, safety, and patient convenience. The layout includes dedicated testing sections such as clinical chemistry, hematology, immunology or serology, clinical microscopy, microbiology with culture and sensitivity, parasitology, blood banking, and histopathology. Each area is strategically arranged near related functions to improve movement of specimens and staff. Essential support rooms, including the media preparation room, sterilization and the decontamination room, electrical or mechanical room, pantry, and locker rooms are placed at the periphery to reduce congestion in testing zones. At the front, the plan features a spacious lobby, business area, and waiting area, ensuring smooth patient reception and flow. Adjacent service entrances, a recording area, and specimen receiving or releasing sections further enhance operational efficiency. Overall, the design reflects a functional, accessible, and patient-centered laboratory environment.
So let's move on to the clinical chemistry section of the laboratory. Clinical chemistry is part of the laboratory that studies the chemical substances found in body fluids, and most of the time, the samples used are serum and plasma, which both come from blood. By checking these fluids, the lab can see changes in different markers that help doctors understand what is going on inside the laboratory. In this section, tests are done using chemical reactions to measure how much of a certain substance is present. These results help doctors diagnose diseases, monitor a patient's condition, and check if a treatment is working. When the level of a substance is too high or too low, it often tells something about how an organ is functioning, like the kidneys, liver, and even the heart. Some of the common tests in clinical chemistry includes a glucose test to measure blood sugar levels, lipid test to check cholesterol and other fats, and protein tests to assess overall health and nutrition. Tests like blood urea nitrogen and creatinine help evaluate kidney function. Electrolytes such as sodium and potassium show if the body's fluid and mineral balance is normal. Enzyme tests can indicate if an organ is damaged because enzymes rise when cells are injured. Blood gas tests measure oxygen, carbon dioxide, and the acidity of the blood, which are important for patients with breathing or metabolic problems.
For the immunology and serology section, it focuses on detecting antibodies and antigens in a patient's blood. These help diagnose infections, autoimmune disorders, allergies, and other immune-related conditions. Using specialized tests such as ELISA, latex agglutination, rapid tests, and immunofluorescence, medical technologists can determine whether a person has been exposed to a pathogen, is currently fighting an infection, or has developed immunity. These tests also help detect conditions where the immune system mistakenly attacks the body's own tissues. Through accurate identification of immune reactions, the immunology and serology section plays a crucial role in diagnosis, monitoring of diseases, and guiding treatment decisions. It helps professionals understand how the body is responding to illnesses and ensures timely and appropriate medical care.
Hematology is the branch of laboratory science that focuses on the study of blood, its components, and the various disorders that can affect them. It involves examining whole blood to assess red blood cells, white blood cells, platelets, and other important factors related to blood function. In the clinical laboratory, hematology tests help diagnose conditions such as anemia, infections, leukemia, blood clotting disorders, and inflammatory infections. Common laboratory procedures in this section include hemoglobin, which measures the amount of hemoglobin in your blood. Hemoglobin is the protein that carries oxygen, so this test helps check for anemia. Next is hematocrit, which shows how much of your blood is made up of red blood cells. It helps assess hydration status and anemia. Next is red blood cells or RBC count, which counts the number of red blood cells. These cells transport oxygen, so the test helps diagnose conditions like anemia or dehydration. Next is white blood cells or WBC count, which counts the number of white blood cells which fight infection. High or low levels can indicate infection, inflammation, or immune problems. Next is platelet count, which measures the number of platelets which help with blood clotting. Abnormal levels may lead to bleeding problems or clotting disorders. Next is differential count, which shows the different types of white blood cells and their percentages. It helps identify infections, allergies, and blood disorders more accurately. Next is complete blood count or CBC, which is a combination of many tests like hemoglobin, hematocrit, RBC, WBC, and platelet count to give an overall picture of a patient's blood health. Lastly, forward and reverse ABO grouping in RHD typing, which determines a person's blood type A, B, AB, or O, and whether they are Rh positive or Rh negative. This is important for safe blood transfusions and pregnancy care. Just to add here in this section, the parasitology section, which is the scientific study of parasitism in both animals and plants, focusing on organisms that depend on a host for survival. Parasites may be protozoans, helminths, or ectoparasites such as lice and ticks. They are found across almost all major animal groups and many plant groups with hosts that are just as diverse. The field includes several subdisciplines such as medical, veterinary, and agricultural parasitology, dealing with specific host-parasite relationships. In the clinical laboratory, parasitology mainly involves examining stool specimens, and one of the most common diagnostic procedures performed is routine fecalysis, which helps detect intestinal parasites and assess their potential impact on human health.
Clinical microscopy is the laboratory that examines urine, stool, and other body fluids. These tests evaluate their physical, chemical, and microscopic characteristics to help identify infections, parasites, and metabolic issues. Because tertiary laboratories use more advanced equipment, the results are accurate and useful for diagnosing and monitoring various health conditions. Its main service include urinalysis, which assesses urine to detect problems like urinary tract infections, kidney issues, and diabetes. The wet smear for Trichomonas checks discharge for the parasite Trichomonas vaginalis, while stool analysis identifies parasites, blood, fat, and other abnormalities related to intestinal infections and digestive concerns. Clinical microscopy also performs pregnancy testing by detecting the hormone human chorionic gonadotropin or HCG in urine, and it offers fecal occult blood testing to find hidden blood that may indicate internal bleeding or colon-related diseases. Overall, clinical microscopy provides essential information that supports accurate diagnosis and appropriate patient treatment. This section is usually located near the laboratory areas such as immunology, hematology, and clinical chemistry. Having these sections close together allows for faster workflow, easier coordination between tests, and quicker access to complementary results, which helps healthcare professionals provide more comprehensive and timely care. So now let's move on for the blood banking. This is the laboratory section that manages the collection, testing, typing, cross-matching, and storage of blood and blood components. These procedures ensure that blood products are safe and compatible for patients, helping to prevent transfusion reactions and reduce the risk of immunologic incompatibility. By maintaining high standards, blood banking supports safe transfusion practices and effective patient care, especially for those undergoing component therapy. The main services provided in blood banking include ABO typing, which determines a patient's blood group, and cross-matching, which ensures compatibility between donor blood and the recipient. These procedures are essential in identifying potential immune reactions before transfusion and in selecting the most suitable blood products for each patient. Blood banking is usually located in a separate, controlled room from other laboratory sections. This is because blood is highly sensitive and must be handled under strict conditions to prevent contamination, maintain temperature control, and ensure the safety and efficacy of blood components. Separating this area also reduces the risk of errors and accidental exposure to infectious materials, which is critical for patient safety. Overall, blood banking plays a vital role in maintaining a safe and reliable blood supply. It is careful testing, typing, and handling of blood components are essential for preventing complications and ensuring that patients receive the right blood products when they need them.
The histopathology section is a specialized area in the clinical laboratory dedicated to the study of tissues to understand the nature and cause of diseases. In this section, tissue samples obtained from biopsies, surgeries, or autopsies undergo several steps, including fixation, processing, embedding, microtomy, and staining, to prepare thin and detailed slides for microscopic examinations. Histopathologists and medical technologists work together to analyze the microscopic structures of tissues, looking for abnormalities such as inflammation, cell damage, infections, tumors, or cancerous changes. Through this careful examination, histopathology provides essential diagnostic information that helps professionals confirm diseases, determine the severity, and guide appropriate treatment plans. This section plays a vital role in patient care, early detection of illnesses, and the overall understanding of how diseases affect the body at the cellular and tissue level.
Microbiology is the part of the laboratory that studies microorganisms. These microorganisms or microbes are tiny living things that cannot be seen by the naked eye. They include bacteria, archaea, algae, fungi, protozoa, and viruses. In the clinical setting, the main goal is to find out which microbes are causing an infection in a patient. The microbiology section focuses on isolating, growing, and identifying bacteria or fungi from different human specimens. This means the lab separates the microbes from the sample, allows them to grow in controlled conditions, and then studies their appearance and behavior. Once the organism is identified, doctors can understand what infection the patient has and what treatment will work the best. Many types of specimens are tested in microbiology. Common ones include blood, urine, stool, body fluids, and skin scrapings. Each specimen can show different types of microbes depending on the infection or body system involved. There are several common tests done in this section. Gram staining is a basic test that colors bacteria so they can be seen clearly under the microscope and grouped as gram-positive or gram-negative. Acid-fast bacilli testing or AFB staining is used to detect bacteria that have a waxy cell wall, such as the bacteria that cause tuberculosis. Culture and sensitivity is one of the most important procedures. In this test, the sample is placed on a special media to allow the microorganisms to grow. Once the organism is identified, it is tested with different antibiotics to see which one can kill it. Another common procedure is the KOH preparation, which uses a chemical solution to clear the sample so that fungal elements can be seen more easily under the microscope.
Our facility features a bold, modern exterior and a spacious entrance leading into a calm, organized interior. The bird's eye view shows an open lounge, efficient laboratory stations, and clearly defined office areas were carefully planned to support smooth workflow and patient comfort. We used SketchUp under the guidance of an architect, wherein we designed every detail you see in these renders, from the overall layout to the interior atmosphere.
For the personal safety measures, the laboratory enforces strict personal safety measures to protect all personnel and maintain a secure working environment. Staff are required to wear appropriate personal protective equipment, or known as the PPE, at all times and practice proper hand hygiene before and after handling any specimens or reagents. All samples are treated as potentially infectious, making accurate labeling, secure containment, and safe transport essential. Work surfaces and instruments are routinely disinfected to minimize contamination risks, while laboratory waste is segregated and disposed of according to DOH guidelines. Equipment must be operated following manufacturer instructions and undergo regular inspection, calibration, and maintenance to ensure safe performance. Additionally, ergonomic practices are encouraged to prevent physical strain and injury during laboratory tasks.
Effective laboratory practice relies on a comprehensive quality management system or QMS that ensures accuracy, reliability, and safety in all diagnostic processes. Key features of quality management include proper specimen collection, labeling, transport, and storage to maintain sample integrity, accurate validation and reporting of results, and complete documentation of procedures, and quality control logs for traceability. Continuous staff training and competency assessment are essential, alongside full compliance with national regulations such as the DOH Administrative Order 2023-37 and related guidelines.
Clinical chemistry. This focuses on the measurement and analysis of blood, serum, plasma, and other body fluids to evaluate organ function, metabolic status, and therapeutic effectiveness. This section relies on both routine and specialized assays to detect biochemical imbalances and support accurate diagnosis and patient management. Strict adherence to PPE, proper specimen handling, and biosafety protocols ensures safe operations, while comprehensively quality control, from sample collection to result verification, maintains the reliability and accuracy of all analytical outcomes. For hematology, it involves the study of blood, cells, and coagulation processes, performing essential tests such as complete blood counts, differential counts, platelet evaluation, and coagulation studies. This analysis play a crucial role in identifying hematologic disorders, monitoring treatment, and assessing overall health. Safety in this section requires careful handling of infectious blood specimens, appropriate PPE use, proper disposal of sharps, and procedures that minimize aerosol formation. Consistent quality control practices help ensure precise instrument performance and timely reporting of critical abnormalities. For clinical microscopy, that is the centers on the examination of urine, stool, and other body fluids to assess their physical, chemical, and microscopic characteristics. This section aids in diagnosing infectious, parasitic infestations, renal conditions, and metabolic disorders. Personnel must follow strict safety measures, including PPE use, regular disinfection of microscopes and work areas, and proper biosafety practices to avoid exposure to potentially infectious materials. Quality control is upheld through correct specimen collection, systematic microscopic evaluation, proper documentation, and prompt communication of significant or critical findings. And for parasitology, this focuses on the examination of stool and related specimens to detect protozoa and helminths responsible for human infections. This section plays a vital role in diagnosing parasitic diseases by using routine and specialized microscopic techniques that ensure accurate identification and appropriate clinical management. Safety in parasitology requires strict adherence to PPE, careful handling of all specimens or as infectious, and consistent disinfection of work areas to prevent contamination. Quality control is maintained through proper specimen collection, validated analytical methods such as wet mounts and concentration procedures, and accurate verification and documentation of findings. Through these practices, the parasitology section this parasitology section ensures reliable results essential for effective patient treatment.
Microbiology focuses on the study and identification of pathogenic microorganisms such as bacteria, fungi, and parasites from clinical specimens. BRIGHTCELL Laboratory perform culture and antimicrobial susceptibility testing to aid clinicians in selecting effective treatments and to support infection control initiatives. These activities operate within strict safety standards due to the infectious nature of specimens, requiring PPE, biosafety cabinets, aseptic techniques, and proper disposal of contaminated cultures. Quality control measures ensure reliable results at every phase, from proper specimen collection and transport to accurate identification, susceptibility testing, and prompt reporting of critical findings. Blood banking involves the collection, testing, typing, cross-matching, and storage of blood and blood components to ensure safe and compatible transfusions. These procedures are essential in preventing transfusion reactions and safeguarding patient health. Because blood products are considered potentially infectious, strict PPE use, aseptic techniques, and adherence to cold chain protocols are mandatory. Quality control is maintained through thorough donor screening, accurate blood typing, proper preparation of components, continuous monitoring of equipments and reagents, precise documentation and evaluation of transfusion outcomes, ensuring that only safe and compatible units are released. Histopathology focuses on diagnosing disease through the examination of tissue specimens using fixation, processing, sectioning, and staining methods. BRIGHTCELL Laboratory perform advanced histological and special staining procedures to provide accurate and detailed pathological assessments. Safety measures are essential, especially when handling chemicals like formalin and using sharp instruments such as microtomes. Proper ventilation, PPE, and standard waste disposal practices are required. Quality control covers all phases from verifying specimen identity and proper fixation to precise tissue processing, accurate microscopic evaluation, documentation of findings, and effective communication of critical diagnostic results to clinicians.